Hey everyone, one of the major frustrations is what? The high out-of-pocket costs that there's going to be when people go on to Medicare, original Medicare Part A and Part B, or a Medicare health plan. Often people are asking questions like, what is this going to cost me? Often they have desires about, can I afford the premium of the plan? And then sadly, there's fears of being denied coverage. Today in this video, I'm going to walk you through and eliminate the frustrations, allow you to understand that you can have a plan for affordable premium, and then we're going to eliminate the fears, because almost any person we've ever served in 17 years and thousands of Medicare beneficiaries we've helped, people are not going to be denied claim if they understand their health plan and understand how to use that health plan correctly. And then we can educate them along the process and along the way. Stick around. I'll be back in just a second to dive into these topics. Hey guys, my name is Kelby Hightower with Medicare Hub. I'm the principal broker of an insurance brokerage that specializes in Medicare health plans. And a lot of times we have people coming in and calling about frustrations about the fear of high out-of-pocket costs. They're enrolling into Medicare for the first time. They're trying to choose a health plan. They're worried about coming off an employer plan. They're having to change their plan. And this is one of the big frustrations for most of you guys are going to face turning 65 or aging into Medicare, but also as you age, is the fear of high costs when it comes to your health plan. The other thing is most people want to find a plan that has an affordable premium, and then you want to not have the fear of being denied coverage. Today, I'm going to walk you through, as I said, eliminating each of these. So hopefully giving you an understanding of how Medicare works, the health plan options, and the costs involved, and allow you to be able to eliminate the frustrations. Really nail down the desires that you have, and then eliminate the fears. So on the recap of the last video that I posted, we talked about the different parts of Medicare. I'm going to go over this quickly with you and then get into kind of the cost of the different health plan options, so it answers these three questions, really the frustration, the desire, and the fear. But starting with that, I want to go over just how Medicare Part A and Part B work again. Just Part A and Part B is what you're entitled to if you've worked 10 years or 40 quarters or longer. And there's some other rules and regulations, and we cover those in other videos that we provide. For those that have a spouse that's worked, for those who have had an ex-spouse that's worked, and you were married for 10 years, there's all kinds of rules and regulations around how do you qualify for Medicare Part A and Part B. But simply put, if you've worked 10 years or 40 quarters, you're going to qualify for Part A services. And Part A services are going to cover everything involved with a hospital. So you have the visual imagery of a hospital, anything involved inside of that hospital. Part A coverage for Medicare is going to cover that. Part A has a deductible. Right now, that deductible is $1,632. It goes up every year by a few dollars. And then Part A, we gave this example. What happens if you stay long-term in the hospital with just original Medicare Part A and Part B? Well, Part A is going to charge you, if you stay up to $150, it's going to cost you $61,608. And so that's a lot of money, obviously. And we want to eliminate, you're like, hey, if I have an affordable premium, but my cost is going to be this, it's not really affordable. So we're going to eliminate these numbers that you see right here. There's no plan that we would enroll you into that you would ever have this kind of catastrophic cost out of your pocket for any year that you have care on a Medicare health plan. So really, you look at this number and it creates a sense of gut-wrenching fear, anxiety. You can eliminate that, because really the reality is if you're on original Medicare and you're on original Medicare Part A and Part B, it qualifies you to enroll into a plan that eliminates these unknown costs that you can have when it comes to Medicare Part A. And then Part B is anything outside of the hospital. So hospital, think about hospital. I always think of a simplified house, but a building, that's the hospital. Anything outside of the hospital is dealing with Part B services. Your primary care doctor, your specialist, outpatient surgeries, outpatient procedures, therapies, diagnostics, blood work, lab work, x-rays, MRIs, CAT scans, PET scans, PAT scans, things like that. That's going to be falling under Part B. That's going to be outside of the hospital. Part B is going to have a premium. Every year you have a Part B premium. Right now, that's $174.70. And then also adjusted premium occur if your income, if you're single or if you're married, depending on what your income levels are, the higher the income, IRMA is this rule that adjusts your Part B premium based on that. We provide this information and explanation in another one of our videos. I would encourage you to watch that video because I explain exactly how IRMA works and then give you a copy of the scale for IRMA, or if you reach out to our office, we'll send you a copy of that. But IRMA dictates whether or not if you're a high income earner, you have to pay more in Part B premium. But otherwise, Part A, you're entitled to if you work 10 years or 40 quarters or longer. Part B you pay for, and it gives you Part A and Part B. Part B has a deductible. Right now it's $240. It's an annualized deductible. That means you pay it one time and that's it for the year. And then Part B has fees to it. It has a 20% coinsurance for any service that you get above and beyond the deductible. So you meet the deductible, you go to the doctor, you have an outpatient surgery done. If the surgery is $10,000, 20% of the surgery would be what? $2,000. So you would have a deductible that you would meet, and then you'd pay 20% on the billable rate. And those billable rates are based on a fee schedule that Medicare coordinates or standardizes for doctors. So doctors can't just charge what they want. They're governed by CMS and regulated by a fee for service scale. And that scale is what the doctor can use. Now, the doctor can charge an excess charge. Most doctors do not. So if a fee for a service was $100, they can charge $115 and you pay 20% of that fee. But typically the doctors don't do this. It's excess paperwork and headache. They usually charge you the fee service scale. So if it's $100, you pay 20% of that would be $20 for the service rendered. So what does all that mean? This basically simplifies down and tells you that if you have Medicare Part A and Part B, it really unlocks the door, or it unlocks the key that unlocks the door to what I call this health plan house. In other words, within this house, you're going to see that there's really two main options of plans that you can choose. You can choose option 1 or option B. There's two directions or two rooms inside of this house. So I always like to say Medicare Part A and Part B is like a key. And with that key, you can unlock the door to the house. And within that house, it has two rooms. And what are those two rooms? Well, room 1 is choosing and enrolling into a Medicare supplement, which I'm going to break down in just a few minutes for you. And then option 2 is a Medicare Advantage plan, or Part C plan. These are private insurance companies like HMOs or PPO plans that have a contract with the federal government. The federal government pays that plan if you enroll into that plan. So you have to always have Medicare Part A and Part B. Often, guys, you'll hear on videos and YouTube and things like that, they'll often say you're losing your Medicare when you enroll into Medicare Advantage plans. Well, that's false. That's a lie. It doesn't work like that. To enroll into either one of these plans, option 1 or option 2, you have to have Medicare Part A and Part B to enroll in the plan. If you lost your Medicare when you enrolled into this, it wouldn't allow you to be eligible. So the information you hear often online and out there talking about Medicare Advantage plans are from people that like to promote Medicare supplements. We like to have an agnostic approach to educating people. That means both plans work if it's a great fit for you. And that's why we explain the plan options. We explain how Medicare supplements work. And in great heavy metro areas, we live around the Nashville area, but Dallas and there's a lot of metro cities. Those cities and areas often have great Medicare Advantage plans with great access to networks and great plans, and people enroll in these plans all the time and have great experiences with the plan. If you live in a rural area, I often say when you walk into the house and you look at option 1, Medicare supplement, or option 2, and you're in a rural area and you're going to travel a lot to access care, Medicare supplements a lot of times are often a greater plan option for you. So being educated. Now, this third option is the prescription drug plan benefit. This is something you want to pick up because Medicare will penalize you if you don't enroll into a drug plan. They'll penalize you per month 1% based on the National Prescription Drug Plan premium average. That is a tongue twister for about 30 to 40 cents a month of penalties. So if you accrue that over a 5-year period, that's 60 months, that can access a pretty hefty penalty if you ever do pick up a drug plan. So we encourage our clients to pick the drug plan up. Medicare supplements don't provide drug coverage. Medicare Advantage plans actually have what they call Medicare Advantage prescription drug plans. That's a plan that covers your Part A, your Part B, and your drug benefit all in one plan. So typically most people enroll in these plans unless they're a veteran or have access to care through an employer-based drug plan or something like that, they'll choose a plan that already has the drug benefit built into it. But otherwise, you want to choose a Medicare supplement with a drug plan. So there's two different policies here. This can be one policy that includes the drug plan itself. So let's go over exactly how this Medicare supplement plan option, this room one or plan one option, as I like to often say and give this analogy, we're turning into the house, we walk into the house, we have this room, it's a Medicare supplement. We often tell people, if your birth date, and this is just how Medicare works, if your birth date is January 1st of 2020 and before, you can actually still qualify to enroll into what they call a Plan F. A Plan F covers 100% of everything. You pay the premium, it picks up all the deductibles for Part A, Part B, and all the co-insurance and the excess charges for Part B services as well. So Plan F, though, if your birth date is beyond that time period, you are not going to qualify for a Plan F. And I often like to tell my clients that Plan G is the second best thing, because here's how Plan G works. It's simplified in these 3 bullet points on your costs. Most Plan Gs for our clients in most of our markets, and we market to about 15 or 16 different states, they're going to have a monthly premium between $110 and $135 a month. Or if you annualize that, it's going to be about $1,320 up to $1,620 yearly. Now, Medicare supplements, you only have a window of time to enroll in those plans when you're becoming eligible for Medicare without any underwriting. Otherwise, you're going to have to answer some health questions and different health questions for different carriers and plans. But in general, you can enroll in that plan. You need to understand that this premium is going to go up by a certain percentage every year. Usually, most of our clients experience single-digit rate increases, but it could have a 6, 7, 8% rate increase a year. It could be 2 or 3%. Over a long period of time, this type of plan becomes very expensive because the premium continues to compound and raise each year, usually on your birth date. So what does that mean? On a Plan G, you're going to be responsible for the Part B deductible that we talked about earlier, and you're also going to be responsible for your monthly premium. As long as you pay the premium, they can't deny coverage. There's not going to be anything that Medicare Part A and Part B covers that the Medicare supplement is going to deny. So the fear of having denied coverage really is eradicated with understanding that the Medicare supplement is going to pick up everything that original Medicare Part A and Part B covers. I like to say Part A goes in first, and then the supplement picks up what's left over minus the Part B deductible. And again, that is talking about a Medicare Plan G Medicare supplement. There are Plan Ns, there are other plans available, but the Plan G is one of the most popular plans with our clients because it's the most comprehensive coverage minus the Part B deductible. And you pay a small deductible at the first of the year or annually, and then 100% of everything else is covered. So that almost $62,000 risk of going into the hospital and staying up to 150 days, it's eliminated with the Medicare supplement plan. Now, let's talk about Medicare Advantage and Part C of Medicare. Medicare Advantage plans, again, you have to have Medicare Part A and Part B to enroll in those, or they're also called Part C plans. You may see something, an advertisement, it calls it Part C. Sometimes they call it Medicare Advantage. Some guys online call them replacement plans, and really that's not what they are. Replacement means it's like it's replacing your Medicare Part A and Part B. Well, if that was the case, we should call Medicare supplements replacements, because in theory, they're replacing or picking up costs. So don't get confused on what people will say often. You have to have Medicare Part A and Part B to enroll in the Medicare Advantage plan. If you don't have Medicare Part A and Part B, you're not going to enroll. If you enroll in it and you drop your Medicare, guess what? You lose your plan coverage with the Medicare Advantage carrier. Now, why are these plans often well liked in certain areas? And again, we usually look in metro areas or where people have access to primary care doctors, a lot of specialists, and access to a lot of hospitals. There are HMO or PPO plans. They do have networks, and if you know the limitation of the network, or if you enroll into a plan that has a very expansive network in an area, usually you're not going to have trouble getting the quality of care that you want. So these plans are going to have 0 to very low premium. Often, most people that enroll, that we help have zero premium. You're going to have small, zero to small copay cost. So most plans will range from zero to about $180 in cost for most things like surgery, outpatient surgery, most outpatient Part B services that fall under these Medicare Advantage plans are never going to have any copay costs typically larger than about $200. Now, there is exceptions depending on the area and things like that. We look up plans and identify if your doctor's in network, your specialist is in network, your medications are covered and things like that. And then we go over, any licensed agent has to go over the exact copays. But in general, $0 to $200. Often going to doctors is zero. Going to a specialist is usually anywhere from zero up to about $40 in copay. So you pay the copay, the plan picks up everything else above and beyond that. Minor coinsurance, so on durable medical equipment, prosthetic devices, and then Part B chemotherapy or Part B drugs, you're going to pay 0 to 20% of the billable rate of those items. So often, the two highest costs on Medicare Advantage plans are two things: is hospitalization. You may have a $250 per day copay, day 1 through 5. So you could have $1,200 or $1,500 if you go to the hospital and stay a long period of time. Above and beyond the 5th or 6th day, the plans cover 100% of the coverage typically. Now, a lot of our clients will enroll into a hospital indemnity that has a cancer rider. And that means if you have cancer and you have chemo treatments, it's going to be billed at 20%. And chemo and radiation and things like that are expensive. The chemo drugs, radiation drugs, and having those treatments are expensive. So that cancer policy actually pays out a lump sum amount of money to that person to cover all their costs. Now, another big thing that's important to understand about Medicare Advantage plans, Medicare regulates them and makes them have max out of pocket. So right now, the max out of pocket is a little less than about $8,600 per year for any of the plans. But most plans in our markets that we have clients in range from about $3,000 to about $5,000 or $5,500 max for the year. That just means for any Part A or Part B services that you pay copays or coinsurance toward, once it meets that maximum, the plan picks up 100% of everything above and beyond that cost. Now, again, there's a lot of detail that I was not able to cover. I wanted to cover the frustrations, the desires, and eliminate the fears in this video. I would encourage you guys to go below, sign up for our on-demand Medicare Made Simple workshop. It's a free workshop. We provide you a guidebook, and we dive deep into all of these different health plan options, all the different things about Medicare, when to enroll and not to enroll, penalties, and all types of different stuff. If you click below, you can sign up for that. Also, guys, takes a second, like, subscribe, and then share this video. You have friends, family, and people like that that you're talking to that are confused about Medicare. Often they're given information. Covered a few things that are a play on words that often you may hear and may create confusion. We want to eliminate confusion, create clarity so you can make the plan choice that's best for you. So take advantage of the video, but also like, share, and subscribe to our channel. Or below, you can actually click a link and schedule a one-on-one call so we can walk you through and educate you about your situation that you're dealing with in your life right now. If you're 64, getting ready to turn 65, or if you're on an employer-based plan, getting ready to retire, and you're really confused about the paperwork and what to do, we can help you with that. Or if you're 75 and you're paying way too much cost for your Medicare supplement, prescription drug coverage, or your Medicare Advantage plan is not covering things like it's supposed to, we'd love to talk to you. Guys, take advantage of all the additional resources and things that we have. And until next time, I will see you on the other side.